I'm very pleased to say that Vivian Balakrishnan, Singapore's Minister for Foreign Affairs, joins us now for a CNBC exclusive interview. Minister, thank you very much indeed for joining us today. Where do we go from here in terms of Singapore's response? Because the number of cases has been rising. We have seen a very, very determined effort by the authorities here to contain the situation. But I'm just wondering, there is a narrative now about even closing the schools and raising the Dorskan level even higher. Do we need to go there?
Well, I think we should first set it in context.
Sure.
This is a global phenomenon. It's all but a pandemic. You just revealed it's 113,000 cases worldwide. In fact, most of the new cases are now arising outside of China. So I think the first point I want to make is that this is a global phenomenon. Maps which do not reveal any cases probably are indications of lack of testing. So that's first point, worldwide. The next point I want to make is going to sound a bit scary from financial markets, is that this problem and its aftermath, its economic aftermath, is going to last at least a year, which means anything we do needs to be sustainable and sensible for the long term. The next point, which is worth thinking through, is that if you look at mortality rates across the world, what we believe the key reason for variation is the adequacy of your healthcare systems, which means as long as your healthcare systems are not overwhelmed, we believe you can get mortality rates at about 1%, hopefully even lower. So those are three things which you need to understand in context.
What makes you think that this situation is going to drag on for at least a year, the economic ripple effects?
Well, because you can see that the genie's out of the bottle. If this had been, like SARS, confined to East Asia, China, Japan, Korea, Singapore, and the kind of social and medical procedures that we could take, there was a chance for containment. Now that you see it has exploded, you look at East Asia, you look at Iran, you look at Italy, and watch the numbers in the United States. Unfortunately, I think the genie's out of the bottle. It's not going to go back.
Do we have to be concerned about recession?
Well, that's just a matter of numbers. I think you have to be concerned about a major impact because it's a global phenomenon and it's going to last quite some time. In the case of SARS, let me speak to you from a medical perspective. It took us about 4 months to get over. It took us probably about 6 months for the economic impact to wear out. This time,
it's going to be worse and
it's going to be longer, and it's going to be all countries. So you need to be psychologically prepared. Now, if I zoom in now to Singapore, in the initial phase, it's obviously about border control, preventing the import of cases. And then the next phase is hard containment, which means identify, isolate, treat, keep mortality low. Beyond that, you then have another phase of delay, meaning you want to ensure that the peak of the epidemic does not exceed your intensive care capacity of your systems. And that means a whole host of social distancing and other measures, which, by the way, have not only a social impact, but also an economic impact. And all governments have to adopt the right balance for the circumstances that they confront. And then you get to mitigation. Now, in the case of Singapore, we're continuing to maintain border controls. We're checking everyone who comes in very, very carefully. But now that we recognize that this is a global phenomenon, and Singapore cannot lock itself out of the world, nor can we shut down, it means from time to time, we will be importing cases. In fact, if you speak to the Chinese now, and I've been in touch with them, I think they are now more worried about importation of cases into China rather than their own containment efforts locally.
But at a purely domestic level.
Yes.
And I'm glad that you mentioned China. The fact that Xi Jinping is now visiting Wuhan, optically, does that suggest that China is near or at an all clear?
I think when you're dealing with an epidemic of a new virus, you're never complacent about it. So for both China and for Singapore, you know, we may have handled the first phase reasonably well, but we will not be complacent. We should not sound the all clear. And I think President Xi's visit to Wuhan is part of his overall campaign to make sure that the situation is under control across the whole of China. And it's an enormous, you know, it's an enormous effort that they have undertaken.
Minister, talk to us about, I mean, if the new risk is importation now.
Yes.
The Costa Fortuna that was allowed to dock in Singapore yesterday, more than 2,000 passengers. Walk and talk us through exactly what was done with and for the passengers to mitigate the risk of importation risk.
Well, first of all, I need to tell you, Singapore was its home port. Secondly, every single passenger on that embarked on that cruise from Singapore.
Okay.
They had been tested, they had been checked before they got on board. So they had to come back here because it's a home port, and this is where the cruise was scheduled to end anyway.
Okay.
Having said that, in an abundance of caution, we checked every single passenger. And then we accompanied them to the airport. I think by now most of them have probably left. And the point is that, you know, cruises...
And can I just confirm,
yes.
So there are 60 Italian nationals on board the vessel, and they are clear?
Who are all clear, who are all well, in fact, before they even embarked on the cruise.
Okay.
Right? I think the point about cruise ships and this virus is that if you don't maintain strict levels of discipline, of hygiene and containment, ships and cruises are very dangerous phenomena.
Indeed.
But if they've started off clean and you've maintained that, and you monitor that very carefully, it can be done. But anyway, I'm not recommending that people go on cruises right now, but I'm just explaining to you why they had to come back to Singapore and how we handled it, and it can be handled safely.
So Minister, I mean, Singapore's policy response to coronavirus, the execution as well, it's been held up in multiple places as a model for how this should be handled by a government, right? And probably rightly so as well. And, you know, you are, as Foreign Minister of Singapore's face to the world with regards to how the island is handling this crisis. Let me ask you, though, for the people at home, though, 166 cases. We've noticed in the last 2-3 days or so, the number of infections, confirmed infections, has actually jumped. We're into double digits now. How concerned should people be? What are you telling them?
I think we should remain eternally vigilant. From time to time, a case, if it goes under the radar and someone with the virus is actively participating in social events, that person can spread. I think that's very clear. In fact, that's what has happened in this case. And that's why we're taking additional precautions, as I said, on social distancing, cancelling or postponing some events, especially if it involves more senior citizens, because we're more vulnerable. So these measures need to be taken. But the point I'm trying to make is that if you understand that this is going to be with us for 1 year, from time to time cases will come in, from time to time a cluster will pop up, and it is important we identify early, go in, quarantine, contact trace, we can damp it down. But even when we damp down this cluster, keep the lookout for the next. So we will have to be in this position for quite some time. That's the point I'm making.
So it's very clear that the government and all the agencies under the government are not letting down their guard. They're not getting complacent in the least.
Not.
But I'm just wondering, Minister, do you have a working time frame as to when we could see an endpoint to the virus, to this outbreak? Because we've been hearing a lot about the summer months in the Northern Hemisphere. It tends to burn itself out. It tends to die a natural death when we're talking about this virus. So does the government have a working time frame on when that potentially could happen?
Let me speak as a doctor. This is a new virus. It is very dangerous and wishful to believe that it will behave according to previous viruses. So we do not make that assumption that this will disappear in the summer months. The situation that we're in right now is there are two possibilities. One is that this becomes a global pandemic, and impact would be horrendous. The other possibility is that it becomes endemic, which means it becomes part of the background viral load in the population.
Don't you feel that it's a pandemic in all but name? on a global basis?
I think we should be prepared. We should assume the worst, even if we're hoping for the best. And you know the Singapore government, we take things very, very seriously. We prepare for the worst, and we get all our measures lined up, coordinated. We communicate with our people, and people understand what we're doing. My main point I'm leaving with you today is that it's be prepared for the long haul and be organized. It's not just whole of government, it's whole of nation. In fact, this is an acid test of every single country's quality of healthcare, standard of governance, and social capital. And if any one of these tripod is weak, it'll be exposed and exposed quite unmercifully by this epidemic.
Minister, I don't mean to put you in an uncomfortable position, but because you're foreign minister, I think I'm bound obligated to ask you about this. Yes. We've been talking this morning about how markets have come back, rebounded, and strongly, right?
Yes.
Because they're hoping or betting that the Trump administration isn't going to come out with some sort of fiscal package to offset the negative impact of the coronavirus. But now they're pricing disappointment because a press conference promised yesterday is apparently not going to eventuate. More broadly, there's this sense that the U.S. is almost laughably far behind in terms of preparedness to fight this virus. Is that fair?
I would not want to engage in that kind of polemic. As I said just now, this is a critical, clear and present danger to all countries, and it's a test of preparedness on all fronts. Your healthcare, your governance, and your social capital. The United States has got enormous resources at its disposal. It's a matter of getting it organized and getting it delivered. So let's wait and see. I would never count the Americans out.
Okay, all right.
There is a perception that Europe now is the new epicenter of this virus outbreak. What is your message to Singaporeans who are choosing to travel there, either for business, either for study, or who are already there, or for leisure?
Well, most of our Singaporeans who are in Italy have returned, and we're keeping tabs of every single one. In my ministry, one of our functions is to keep track of Singaporeans who go overseas and who may run into trouble, and we've given a commitment that we will leave no Singaporean behind. We're also asking everyone e-register so that we can communicate, we can stay in close touch. So that's the privilege of citizenship. A crisis is also a test of the value of your citizenship, of your society, and of your government. That's what we're all confronting.
Minister, I have to ask you this. One of your cabinet colleagues, Lawrence Wong, this was yesterday, was talking about the possibility of closing schools in Singapore. To date, this is not a measure that the government has decided it wants to or needs to undertake. Let me ask you, how close is the government to closing schools? What would it take to trigger that kind of response?
Well, again, to put it in context, closing schools is just one of a suite of measures for social distancing. And the key parameter for judgment is whether you need to take such extreme measures because you're worried that your infection rate will exceed your treatment capacity. So it's a very dynamic thing, and we'll have to watch this very, very closely. I mean, just to give you an idea of numbers, right? The latest data indicates that in 19 days, if you miss it, the number of cases will increase by a factor of 10. That's actually what happened probably in Europe and in Iran. In the case of Singapore, we're determined not to take our eye off that ball. So watch out for our announcements on a daily basis because we're watching this very closely. We know how quickly things can move. So it's that, vigilance, quick action, coordinated action, and ability to not just announce things, but to deliver it. Yeah. And in the case, one great advantage we have in Singapore is not just being able to deliver, but that our people do it. That social capital of trust and compliance when the chips are down with an extreme situation is absolutely crucial.
You talked about capacity to manage this crisis in terms of human resources, in terms of physical capacity as well, yes. Hospitals, the healthcare system, et cetera. We've had the number of infections jump to double digits in the last 2-3 days or so. Yeah. We've had the number of patients in ICU also yes. almost double. But
no, we have about 9, last I checked, about 9 cases in ICU. It's no accident that so far, we've had 0 mortality. Now, we cannot assume we'll have 0 mortality. That's not possible. Right? But as I said, if you look even in the experience of China, mortality is higher in areas where you have overwhelmed your intensive care capacity. In the case of Singapore, and I've spoken to the doctors on the front line, and they tell me, look, we've got the resources, we've got the staff, we've got the equipment, we've got the bandwidth to do our best for those patients.
So we have
that
more
is
than
the key
enough
difference.
Capacity is the point you're trying to get across.
We have more than enough capacity for now, okay. and our objective is to make sure we always stay ahead of the curve. Right. But let me tell you as a doctor, these are things which you can't just build up overnight. Mm-hmm. It's years and years of investment in people, in systems, in capacity. Even from a foreign policy point of view, we now have test kit diplomacy. Right? Because what do we need to do as a world? We need to share best practices. We need to rapidly develop test kits, vaccines, antivirals. We need to share the fruits of applied research. We need to coordinate our measures. And if you look globally what's happening now, in China, really, they're trying to reboot their economy. Mm. In Japan and Korea, they're trying to get to grips with community transmission. I think in Italy, it has had to adopt some possibly unthinkable measures to lock down the whole of Italy. And the rest of the world should be on standby and make sure we do all that it takes to make sure you don't overwhelm your healthcare facilities.
Minister, I've lived here for 20 years, and I've got to say the response, I've seen SARS, and I've seen the response here to COVID-19. It's been nothing short of remarkable, and the government is on a crisis footing. Nonetheless, I hope you don't think that this is a fatuous question, but is this going to affect the timing of the election?
You'll have to ask the Prime Minister that, but the election is not the most important thing right now. The most important thing is that we get over this together, and we get over this together with our neighboring countries, our region, and indeed at the global level. Right? So this is a time to focus on delivery, getting things done. The politics will take care of itself.
Do you think that this changes the relationship between Singapore and China?
The relationship between Singapore and China is excellent. And let me give you some data for that. It is true that we were one of the first to announce some travel measures. But I can tell you that China has also told me they understood. They understood our unique circumstances as a tiny, hyper-connected transshipment and travel hub, why we needed to be even more careful than others. Secondly, there's been close communication, both at the political and the professional level. The fact that China published the genome in early January was the reason why we were also able to develop the PCR test kits, which in a nice circle, we were able to help provide them when they needed some additional help. Now we're continuing to discuss not only overcoming the problem in the containment phase, but we're also looking beyond that. Beyond this phase, beyond this month, for the next 1 year. How do we reboot economy? How do we handle a sustainable posture for travel?
Yes.
And how do we keep life going? Because you see, there is also a fallacy that there's a trade-off between healthcare and the economy. Actually, they're both sides of the same coin. If you don't have an economy, if you don't have resources which you can devote for healthcare and for keeping your society going, you then face a very sticky situation.
And vice versa.
So we're working very closely with China. I can tell you our relations are excellent, based on trust, based on a long track record of interaction.
And can I just pick up
Yes.
on your point about test kit diplomacy? And when you look at your neighbours and your partners within the region, I'm thinking specifically about Indonesia, where there has been very few cases reported. Is that symptomatic of the lack, to your point, of the lack of testing facilities and test kits? And is Singapore in any way out there helping Indonesia in that regard? And are you concerned about imported cases from Indonesia if we don't really have a clear idea of the situation there?
Let's again put things in context.
Sure.
We have the world's busiest land crossing. Every day, 300,000 people cross
Malaysia, yes.
between Malaysia and Singapore. 4 of the world's 10 most busy air routes are in ASEAN. Singapore KL, Singapore Jakarta, Bangkok Jakarta, etc. 37% of all travel within ASEAN is intra-ASEAN trade. So I've told my fellow foreign ministers, we're actually one hot zone. And we're all in it together. And I can tell you, without revealing details, that we are sharing information, we are sharing capacity, and we are coordinating our measures. We're in it together, and we can't resolve this unless the whole world, and in particular for us in our region, ASEAN gets it right.
So rendering direct assistance to Indonesia, also Malaysia?
We are working very closely with them.
Both.
Very, very closely. Because, you know, like I said, it's not just a form of words to say we're in the same boat. This virus now has shown it really doesn't respect passports, boundaries, politics, and it's just a time to work together. Finger pointing, making unnecessary comments are unhelpful. Let's just get on with it.
All right. Need to sneak in one final question, which is totally unrelated to the coronavirus.
For a change.
If not, if only obliquely here. And that's the situation, what's been going on with oil. There's price war that's erupted,
Yes.
Saudi Arabia, Russia. And we've been wondering whether or not, you know, it seems as though Russia's targeting the U.S. and U.S. shale, right? Which makes us wonder, the Trump administration, is it going to be reaching out to more likely MBS and the Saudis? They have a more direct line there. Or is it going to be Trump calls his buddy Vladimir on the phone and goes, look, hey, listen, you got to help us out here. What happens, do you think?
That's a profound question with many answers.
Okay, go ahead.
Number one, the world is undergoing an energy transformation. Right? So the whole question of fossil fuels, renewables, that needs to be sorted out. Number two, the main change in fossil fuels has been the advent of shale, oil, and gas, and the fact that the United States is now independent, energy independent. That's a major phenomenon which I think people have not yet completely understood the ramifications of that. The next point is that this virus has also brought to a head the fact that you're going to get multiple downstream impacts on the economy. First, you get the immediate fear, which immediately has an impact on tourism, on hotels, retail, and the rest of it. The secondary effect is on supply chains, and we didn't get time to discuss it today. But supply chain disruption has got profound impact on economic growth everywhere. The third impact is on energy.
Yeah.
So you have a demand side collapse, at least in the immediate to medium term. You've got a systemic problem because of shale gas.
Yeah.
So that's all those challenges. So my expectation is great volatility.
Okay.
Economically, equities, commodities.
Bryce, understood. Minister, fantastic talking to you. Thank you so much for your time.
Minister.
Thank
Hope
you.
to see you again very soon.
All the best.
Okay, indeed.